Kat Hepburn, and Kat did her practicum with the Blue Mountain Clinic, and her site mentor is Dr. Eric Ribitz, who is the medical director there. And the name of Kat's presentation is Development of Inclusive Sex Education Programming. So I'll let you take it away, Kat.
Thank you, Lee. Good afternoon, everyone. As Lee said, my name is Kat Hepburn, and I'll be talking about the APE, which is the development of inclusive sex ed programming at Blue Mountain Clinic. And my site mentor was Dr. Eric Rabitz, who is the medical director. So off the bat, I do want to say that I am the operations manager at Blue Mountain Clinic. However, this entire project falls outside of my scope of work at the clinic. The practicum work was entirely separate. For my normal job duties, we even used a separate clock-in function, and it was fully paid for by grant funding that was specific for education and outreach. Blue Mountain Clinic is a full family practice in Missoula, Montana, which also provides abortion care and gender affirming care. And their mission is to provide comprehensive and evidence-based primary healthcare services in a compassionate and empowering environment to all persons who seek it. We're especially honored to provide abortion care services, gender affirming care, and mental health care as essential and fully integrated components of primary health care. My goals in this project were to assess the needs of our community and develop a comprehensive, age-appropriate, and medically accurate reproductive and sexual health workshops for individuals aged 18 to 29 in the Missoula area. The final product, as I'll get into, are two items, the results of this needs assessment that I did, and then a fully designed curriculum. In-person or virtual workshops may be completed at a later date. That would be at the request of Blue Mountain Clinic. We didn't go that far. So my needs assessment was a 24 question survey administered via Qualtrics, consisted of a mix of closed-ended and open-ended questions covering various aspects of sex education, inclusivity, and program effectiveness. Those questions were designed to capture demographic information, experiences with existing sex ed programs, and perceptions of inclusivity. And then the curriculum itself was fully designed with 7 distinct lesson groups. They all have readings, videos, activities, and objectives included. It contains about 14 hours of instructional content, and it is based on the National Sex Education Standards, with the additional elements that were requested from the needs assessment that I did. The competencies I aim to achieve in this project were to design a population-based policy, program, project, or intervention, to apply principles of leadership, governance, and management, which include creating a vision, empowering others, fostering collaboration, and guiding decision-making, selecting communication strategies for different audiences and sectors. And the concentration-specific competencies were to assess needs, resources, and capacity for health education and promotion, and to plan health education and promotion programs. So as I stated, the needs assessment utilized Qualtrics. There were open-ended and closed-ended questions. Individuals aged 18 and up were recruited for participation, and I used social marketing strategies to do that. The survey itself was open for 3 weeks, and before I conducted the assessment, the project was reviewed by the Institutional Review Board at the University of Montana, and they deemed that this study as written did not require further IRB review because it didn't fall into the category of research involving human subjects. The study did adhere to ethical guidelines, ensuring participant privacy and confidentiality. There was informed consent obtained before anyone began the survey, and they were given the information on the study's purpose, voluntary participation, and the use of collective data. 113 individuals responded to the survey, ranging in the ages from 18 to 89. No question was answered by 100% of participants, and I do think that that is because there were too many questions. So that's something that I learned. the population for whom our intervention is being designed, 18 to 29 years of age, comprised about 41% of the total respondents. And these are just some examples of the data. You can see 71% of the people who took the survey identified as female. And then this is some of the coded thematic analysis. One of the things people brought up over and over again was abstinence, and that being a limitation to sex ed programs that they had been exposed to in their education. And then here is one of the questions I asked was, are there any specific cultural considerations or preferences that should be taken into account when developing reproductive and sexual health education programs? And so people wanted us to think about privacy, making sure things were inclusive of the LGBTQ plus community, thinking about the modesty that might be part of people's cultures, and then really specifically using inclusive models, people of color, people who don't subscribe to gender binary, people of size, and then thinking about language barriers, disabilities, and access to the internet. So the recommendations that I got out of this whole needs assessment are these that we need to focus on. The practical aspects of sex, so STI testing, safe sex practices, vaccines, contraception, menstruation, PrEP. Those are things that are really covered in most sex ed programs, but we wanted to make sure those were included. And then looking at queer sex ed, pregnancy options, and demystifying how those things work, including disability, body neutrality, making sure harm reduction was addressed, pleasure, masturbation, porn, sex toys, affirming gender identity, and then reproductive justice, which is the right to have children, the right not to have children, and the right to raise children in a safe and healthy environment. That comes from Sister Song. So then in designing the curriculum, there are 7 lesson groups that contains about 14 hours of instructional content and designed for in-person instruction. This could easily be done in a virtual interactive environment, but is probably not quite ready for asynchronous learning. And this is an example of one of the lessons. This one's on sexual health. And so you can see that I have the outline of the learning goals, the understandings. There are some materials, so some videos that could be assigned to watch ahead of time, or you could watch them during instruction together. And then 2 activities, there were 4, but these are just 2 of them, the condom behavior game and STI bingo, kind of get people engaged. And these are examples of what that might look like. So fun bingo card, and these index cards of behavior with condoms, thinking about what's safe and what's absolutely not safe. Oops. So some of the barriers, time constraints, even with my ILE and APE at the same place on the same project throughout the year, I don't feel I even scratched the surface. There is so much work to be done on this kind of programming. And then resources, a lot of activities and curriculum design aids are behind paywalls. And if you don't have the resources for that, it's hard to get any of that. Challenges designing curriculum that was appropriate for adults was difficult because most resources that you're finding are for school-aged teens. And most of the lessons I think I designed are a little too young for folks who are on the higher end of a young adult. Organizing the lessons in a way that felt organic. And then halfway through the school year, Blue Mountain Clinic's executive director changed, and that former executive director was my site mentor. And so that was a challenge to change mentors halfway through the year. Thankfully, Dr. Rabbits was happy to step in for me. I was surprised that there aren't more lesson plan templates available for use publicly. I don't love the template that I ended up with, but maybe that's a future project. What I was not surprised by were the results of the needs assessment. people were really confirming what I already thought, is that there are gaps in education, sex education. Thank you so much.
Thanks, Kat. Great. So we've got a few questions in the chat. I first want to just say a big shout out and thank you to all the site mentors. We can't do this work without all of you. So thank you very much to all of you. The first question is for Katie, and it came from Dr. Harris. And she asked, Katie, what other training did parents get before the babies left the hospital? So they got your binder, but did they get any other training?
Yeah, thank you, Dr. Harris, for asking that question. And Julia, you can chime in if you need, the nurse in the group, but there is a discharge teaching checklist that is in the NICU room, and you have to get through all of the items on the checklist before the baby is deemed ready for discharge. And so usually it occurs in 3 different steps. So there will be all these different tasks, such as cleaning the site or changing it out, or providing a feeding. And the caregiver will be verbally told that, and then will be shown a demonstration, and then will be asked to demonstrate it themselves. And then it's not required, but the nurses do really suggest that caregivers spend a full 24 hours in the NICU so that they're getting that around the clock feeding time with the support from nurses, and to have both caregivers available too, so that there's that extra support services if applicable. But
awesome, thank you. It does sound like the training really dovetails. Your binder dovetails with what they're getting at the hospital too. They're getting the practice, and then you're giving them the follow-up. Nice.
right, yeah, and it's just ensuring that they're remembering things, because they're given so much information, and so having something that they can refer back to when they will forget the first or few times that they hear it too.
Awesome, thank you.
Great, thanks, Katie. Thanks. So it looked like Kat answered Stacy's question, which is, will Kat slides with the links to the lessons be available? So thanks. Sounds like Kat says she'd be happy to make those available and usable. So that's great. I'll let you guys connect. Any other questions out there? You can either put it in the chat, or you can unmute yourself. Here's a question from Tess Carlson for Kat as well. Do you envision the curriculum being used by health departments or other entities?
That's a good question, Tess. Right now, our vision is that it would be something that we would provide at Blue Mountain Clinic as a community-based organization, and eventually it would be something available on our website for folks all over to access. But if other entities or health departments are interested in partnering on that kind of thing, I'm sure we would be open to doing that. Yeah.
Thank you.
Yeah.
Yeah, that's great. Yeah. And interesting, super interesting project there, Kat. I know that initially Kat did want to delve into the younger population, but I think that was gonna open a big can of worms there. So
yeah.
I'm glad you got to do what you got to do. Okay, Rebecca. Is Rebecca still with us? If she is, she's got a question here. Where did you find all the resources and recommendations that went into the dashboard?
Yeah, I got them from a lot of different places. Some of it was from the CDC. I actually was struggling to find some for Montana, so my site mentor gave me a couple of links. But 3 of them, like the fire, the drought, and the cost. I went to the Montana Professionals for a Healthy Climate conference 2 weeks ago, and they had people presenting those resources, and I was like, oh, sick. So I found them from that conference and then linked them into the dashboard. Because I mean, they're public, so they're just embedded and then cited.
Cool. Well, thanks a lot, Rebecca. It looks like it's going to be a great resource for the county.
Thank you.
Yeah, great. Thanks. Okay, any other questions for our cohort this week? You guys have all done a great job. And again, thank you to all of the site mentors. If we don't have any more questions, I think we can wrap this up. Next week, we'll be back with 3 presenters. So I hope many of you can join us next week, and congratulations to all 4 of you today for completing your presentations. And yes, big round of applause. So thanks, everyone. Great job. And hopefully we'll see you all next week.